Good afternoon, and thanks for joining us. Today, Dr. Walensky will provide an update on Omicron. Dr. Fauci will present the latest science, and Dr. Murphy will discuss Pfizer's vaccine application for kids under the age of 5. And then I'll cover operational planning so that we're ready for that age group. With that, over to Dr. Walensky. Dr. Walensky?
Thank you, Jeff. Good afternoon. I'd like to start by walking you through today's data. The current 7-day daily average of cases is about 446,400 cases per day, a decrease of about 36% over the previous week. The 7-day average of hospital admissions is about 17,100 per day, also a decrease of about 14% over the previous week. And the 7-day average daily deaths are about 2,300 per day, which is an increase of about 4% over the prior week. While we continue to see large decreases in average daily case counts across the country, hospitalizations remain high, stretching our healthcare capacity and workforce to its limits in some areas of the country. And daily deaths also remain quite high. And with the mixed news above, similar to other waves during the pandemic, our data continue to reinforce the critical importance of vaccination. Last week, I shared data from our surveillance studies demonstrating the effectiveness of vaccination, including boosters, on decreasing cases, emergency department visits, and hospitalizations. Additional new data continue to support these findings. On this slide, you can see data from 25 U.S. jurisdictions that report cases and deaths linked to vaccination status. Similar to what I showed you last week, vaccination and booster doses substantially decrease the risk of death from COVID-19. Looking at the data from the week ending December 4th, the number of average weekly deaths for those who were unvaccinated was 9.7 per 100,000 people, but only 0.7 per 100,000 people for those who were vaccinated. This means the risk of dying from COVID-19 was 14 times higher for people who were unvaccinated compared to those who received only a primary series. For those who were boosted, the average of weekly deaths was 0.1 per 100,000 people, meaning that unvaccinated individuals were 97 times more likely to die compared to those who were boosted. I also want to share new data from CDC's COVIDNet hospital surveillance network to further show how essential vaccination and boosting is in preventing hospitalization from COVID-19. On this slide, you can see data comparing the percentage of people aged 65 and older who are unvaccinated and boosted in the general population in blue, and those who are hospitalized in green. As shown on the slide, only 12% of those aged 65 and over remain unvaccinated in the general population. But when we look at those over the age of 65 who are in the hospital for COVID-19, 54% are unvaccinated. In stark contrast, now let's look at those who have been boosted on the bottom. Here, 57% of those over age 65 are boosted in the general population. And only 8% of those over the age of 65 and in the hospital for COVID-19 have received a booster dose. These same trends are seen across all age groups. These data show us that the percent of people who are currently hospitalized due to COVID-19 are disproportionately unvaccinated and disproportionately not boosted. Additionally, these data confirm that vaccination and boosting continue to protect against severe illness and hospitalization even during the Omicron surge. If you are not up to date on your COVID-19 vaccinations, you have not optimized your protection against severe disease and death, and you should get vaccinated and boosted if you are eligible. Thank you. I'll now turn it over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do over the next couple of minutes is to address a common misperception and the result of misinformation. And that is whether vaccination negatively impacts people trying to conceive, namely, does it have a negative impact on fertility? The data are clear. Next slide. I will show a couple of representative studies. This published just a week and a half ago in the American Journal of Epidemiology, which is a prospective cohort study of vaccination and SARS infection and fertility. The study is an NIH-funded pregnancy study online, or PRESTO for short, of couples who are trying to conceive through intercourse. It enrolled participants before pregnancy and collected data on vaccination and other variables during the preconception period, and then collected data on subsequent fertility. There were over 2,000 females between the ages of 21 and 45 in the US or Canada. They were enrolled between December 2020 and September 2021, and they were followed through November 2021. Next slide. The data are clear. COVID-19 vaccination in male or female partners did not affect the likelihood of conception. Couples were 18% less likely to conceive if the male partner had been infected with SARS-CoV-2 within 60 days before a menstrual cycle. That is infected, not vaccinated. However, COVID-19 disease only temporarily reduced male fertility. Next slide. In another study published again about a week and a half ago, this was in an in vitro fertilization clinic. And the question that was asked, that were people vaccinated, in this case, either with the Pfizer or the Moderna product, had similar responses to ovarian stimulation, which is used to stimulate the ovary in preparation for in vitro fertilization, and similar pregnancy outcomes compared with unvaccinated people. The reproductive potential does not appear to be affected by vaccination in people who undergo in vitro fertilization. Next slide. So what's our takeaway message about vaccination and conception? New data add to previous studies that indicate that COVID-19 vaccination does not negatively impact fertility. CDC and professional medical organizations serving people of reproductive age emphasize, as shown on this website, that there's no evidence that vaccination impairs fertility. And of course, as we've all said over and over again, vaccination is recommended for people who are trying to get pregnant now or might become pregnant in the future, as well as their partners. And anyone who's vaccinated and pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future, should also get a booster shot when eligible. Final slide. The message is the same. Get vaccinated and get boosted for so many reasons. Now over to you, Dr. Murthy.
Well, thank you so much, Dr. Fauci. And it's good to be with everyone again today. As many of you know, the FDA has now received Pfizer's application for a vaccine for children aged 6 months through 4 years. Now, Jeff is going to talk more about how we're preparing for the possibility of this milestone. But first, I want to walk you through the process. Pfizer's application will now undergo the same independent, rigorous, and transparent review process that was used to authorize the vaccines that now more than 250 million Americans have received, including millions of children ages 5 and up. It will involve the FDA receiving the full data from Pfizer, posting that data publicly, and then convening its advisory committee for a transparent discussion of the data. The FDA will then render its opinion, after which the CDC and its advisory group will assess the data and make their recommendation. This is the same rigorous process that was used to assess numerous vaccines long before the pandemic began. I know how eager parents and caregivers are for the good news on this front. For much of this pandemic, millions of parents have carried with them an added layer of worry, knowing that their children under 5 didn't have protection from COVID the way older vaccinated children do. I felt this worry too, as the father of a 4-year-old daughter who's not yet eligible to get vaccinated. That's why I'm hopeful that we may be one step closer to having an added layer of protection for our younger children and one less worry for their parents. A vaccine for children under 5 would mean we would have vaccines available for essentially all age groups in America. This would be a major milestone. Now, there are a number of steps ahead to determine if the vaccine is both safe and effective for our kids under 5. And please know that the FDA will not cut any corners in their review process. They know that they are the gold standard that all of us rely on. If and when the FDA and CDC decide to move forward, we will work closely with our trusted community partners to ensure that families have accurate science-based information about the vaccine so that they can make the best decisions for their children. And as we await this review process, I want to emphasize once more just how important it is that the rest of us get vaccinated and get our kids 5 and older who are already eligible vaccinated as well. If you are 12 and up and you're vaccinated, please get boosted as soon as you're eligible. And all of us should wear high-quality masks when in public indoor settings. This is how we can continue to create a wall of protection around our children under 5 as we look to safeguard their health. Thanks so much for your time today. I'll pass it to Jeff.
Well, thanks, doctors. If the FDA authorizes and CDC recommends this vaccine, 18 million children under the age of 5 will become eligible for protection from COVID-19. Before we open up for questions, I want to share how we're preparing now, just as we did with vaccines for kids ages 5 to 11, so that we are ready and we hit the ground running following decisions from FDA and CDC. Importantly, this vaccine is specifically formulated for kids under the age of 5. So we're working closely with states, local health departments, pediatricians, families, doctors, and pharmacies to ensure the vaccine is available at thousands of locations nationwide. We've already secured ample doses and the necessary needles and supplies specially made for kids in this age group. Following FDA authorization, we would immediately begin packing and shipping doses to states and healthcare providers. And in short order, following CDC recommendations, parents will be able to get their kids under 5 vaccinated at convenient locations they know and trust. While we know many parents are eager to get their kids the protection of the vaccine, we know others have questions. So we're working with our partners to ensure all parents have access to the facts and information they need to make the right decision. And as always, we're laser focused on equity and making sure we reach the hardest hit and most at-risk communities and families. A year ago, we stood up a historic nationwide vaccination program that's now gotten 75% adults in the U.S. fully vaccinated. We then launched a boosters program that's gotten almost 90 million Americans their booster shot. And we established a vaccination program specifically for kids ages 5 to 11 that has protected millions of kids around the country. Now, with the potential vaccine for kids under 5 on the horizon, our message to parents and families is simple. We're doing everything we can to prepare now. We're taking all of the best practices and applying all the lessons learned over the last 12 months to ensure getting kids under 5 the protection of vaccine is easy and convenient. And we'll be ready to start getting shots in arms soon after FDA and CDC make their decisions.